A pioneer in the field of healthcare technology, Dr. Catherine Mohr is helping advance the rapidly emerging field of minimally invasive robotic surgery.
People think robots and they think it's like some science fiction robot that's actually doing the surgery. But really it's more a telemanipulator. It allows you to do more complicated surgeries than you would be able to do either laparoscopically or arthroscopically through very small instruments that you can place through a small incision in the body, but be able to do everything that you'd be able to do if you had a large open incision. So the surgeon is still doing the surgery, but the robot is providing the surrogate hands and surrogate eyes for that surgeon that just happen to be down inside the patient. Telepresence robots actually trace their lineage back into the 1950s, where the first people that started doing this kind of work were in the nuclear industry. And what they wanted to do is they wanted to have a trained operator on one side of a protective barrier able to do things on the other side of that barrier. We now see telerobots exploring the depths of the ocean. We see them driving around on the surface of Mars. Anywhere where you can't put the human, but you could send a machine there, then you want to be able to interact with that remotely.
One of the challenges that healthcare seem to be facing is not so much of new technologies, it's one of access and affordability. Does that present any obstacles with regard to robotics?
Not, I think, if you price your robotic surgeries properly. Robotic surgery costs a payer just the same as an open surgery. While the instruments cost money, they end up making back that money in discharging the patient that much earlier. So they're not paying for the patient who had a big open incision to stay for several days. Instead, after they had their minimally invasive surgery, they're able to be discharged in 1 or 2 days. If you look at it in cancer therapy, doing this kind of surgery is actually much more cost effective than, say, radiation therapy.
So when you're looking at the next generation of robotics, what's your vision of the role that they'll play in our healthcare landscape in 5, 10, 20 years?
Well, I would say that we will probably have more purpose-built surgical robots that will work in the eye, will work in the joints. I also start to see robotics as extenders of care. I think whenever you've got a person to be there, that personal touch is going to be much better. But if there's a person that can come by once a day and check in on somebody and make sure that they're doing all right, and the rest of the time the robot can keep an eye on them, remind them to take their meds, monitor if they're not doing so well, kind of the equivalent of the twice-a-day phone call from the concerned child. We see robotics with telepresence, where a physician can go and talk to a patient and be able to do a physical examination on a patient without actually physically being there. So I think that with appropriate application of this technology, we'll be able to give a lot more care to a lot of people who need it and not really increase the costs very much.